minutes to get an intro done. And then we'll just get started. I'll invite you to do that. So, ladies and gentlemen, welcome to our webinar today. Happy to see you. Happy to see our speaker today. So today we are talking about personal branding, and that is something that is crucial for us doctors. I know here we are doctors from various cadres, various professions. We have medical students here as well. We have consultants and medical students. So I think this is a crucial thing for us, not just for how we should put ourselves out there, but also for our daily interactions with other professions. So a little housekeeping before we get started. You can engage actively by taking notes and preparing your questions, because you're going to have a Q&A session at the end of this. And I'm hoping that all of you have prepared your Q&A sessions. We're going to have about 30 to 35 minutes of presentation. Then thereafter, be about 10 minutes to 15 minutes of Q&A. And then after that, I'll summarize what we've talked about, and then give a closing remark. And if there are no other concerns, we will close the session. I'll tell you a little bit about our speaker today. Our speaker is called Dr. Elizabeth Okemwa. She's a general surgeon. She's doing several other things. She's an advocate for women's health. She's a medical educator. She's a mentor and a coach. Right now, she's working at Tenwek Hospital. She's the chairperson and founding member of Kenya Association of Women Surgeons. She's dedicating to advancing surgical education and improving healthcare in Kenya. She also serves as the departmental head of radiology at Tenwek and is a fellow at the American College of Surgeons. In her encounters online, she talks about mental wellness and financial management for doctors. She talks about medical education and training. She's big on mentorship and coaching. And right now, she's building a legacy in medicine, a mission to impact the lives of other doctors. So I'm looking forward to this session, and I'm hoping that all of you will leave here better than when you joined. I see a number of you have joined already. Looking forward. This session is recorded. You'll be able to access it online after we publish it on our channels. And then for doctors who need CPD points, this session is also CPD accredited. So thank you so much, Dr. Elizabeth, for allowing yourself to be here, and you can take it away at your convenience.
Okay, great. Again, my apologies. I really had prepared some really beautiful slides. It seems like I need to up my game on IT matters. It's taking a while. It's 22% loading. Let me try and send it to you, Daktari. But as Dr. Bonke has mentioned, my name is Dr. Elizabeth Okemwa. I'm a general surgeon, a surgical educator, a mentor and coach. I would say we'll talk about mission statement, but basically, I would wish to hope that one day someone can say that my mission was to transform lives through surgery, surgical education, and surgery and education. And education can be seen from the medical sector and also from young children, because I believe our welfare education is very important for children and for us as we start. A disclaimer, Dr. Bonke, I officially left Tenwek 3 months now. It will be 3 months on the 27th. In transition and in looking at what, taking some space to just think on what to do next. I think life should not be lived in one way. I have been and served in Tenwek in different capacities for 15 years. I'm proud of being a member of Tenwek Hospital. I am, because of all the good training that I got there. But also, I think at some point also we need to allow our colleagues or our trainees, since I was a trainer, facilitator, to take up the spaces that we have. No man is an island. I want them to be better than what I am. Dr. Bonke, check and see if the email has come to you. So I would share by saying that for me, this started as me writing all down from 2018, my desires in life and my purpose in life. And I had a passion to just train people who are below me, especially healthcare professionals, on the things that I thought if I went ahead, I would have wanted someone to have taught me. And that's things like personal branding, proper mentorship, guidance, and just someone who can be offer guidance and someone who can hold you accountable, as well as finance, the medic and finance and entrepreneurship in the health sector. So I've done bits and pieces of that, but on this year, it was surprising that Dr. Bonke actually came to me and just asked, "Hey, Doc, we really want you to come and talk to us about personal branding," because I believe I'm still developing my brand. And if in any way it helps one or two of us here, then great. It's an absolute pleasure to be presenting or talking in front of you all. So, Dr. Bonke, any hope or no?
Yes, just a minute and then I set it up.
Okay, so maybe if you have any other assistant, it would be interesting to know what people's thoughts and perceptions on what personal branding is. We can take 3 minutes and people can put it down on what your thoughts are. When you think of personal branding, what comes to mind? You can put it down on the chat box as Dr. Bonke is setting up. Just put that down on the chat box and we can share. Doc is the one that has my image. I hope it's that's the one I've sent you. So we have
Are you able to see my screen?
packaging.
Are you able to see my screen, Doc?
Let me go back. Yes, perfect.
All right.
So you can share it as a slide presentation, as a show or something like that. The beauty of digital. That's a plan B. I'm happy it's working. Anyone else? Packaging? Someone mentioned packaging. Personal branding is how we put ourselves out there. That's good. By Bivon. Madeline says, being unique and standing out in a pool of many like you. What you represent, I love that. It means developing an image that you would want to project that is aligned with your natural inclinations. I love that. The image you present to the public of yourself. Perfect. Who you are and what you believe. What I'm known for. I like this. What people think about when your name is mentioned. Awesome. So we can close. We've done the lecture. We can all go, right? What people say about you when you leave the room. Yeah. Sometimes how you distinguish yourself from everybody else. Like that. Anyone else who wants to chip in? Authentic self-presentation in a catchy way. I like that. Anybody else? We don't want to leave anyone behind. These are all right answers. There's no wrong answer. Anyone else? What's a personal brand? Developing an image that you would want to project that is aligned with your natural inclinations. I think I mentioned that. Thank you, Martin, Mary, Victor Baraza, Wainaina. I like that. Grace. Benjamin Nyariki mentioned how you distinguish yourself from everybody else. So those are all right answers. Thank you. Next slide. So you're all, and sometimes I will say, your personal brand precedes you even before you walk into a room, and then it will leave or it will remain after you've walked out of that room. Your personal brand might open doors for you sometimes, yeah? And your personal brand is what, you know,
Hello, Doc. We have missed you at the introduction part.
yeah, you can hear me now.
Yes, I can.
Can you hear me?
Yes, I can. Go ahead.
Okay. So I'll try and go straight up because of the internet. So you have all said the right thing. We're going to the next slide. A personal brand, as I mentioned, goes before you in a room and will also stay after you've left a room. It speaks turns without speaking words. As healthcare professionals here, what is constant is your degree, or the degrees that we have are all uniform. I'll say that. When you finish and you graduate, we all graduate with an MBCHB in our title. The training that we get in the university, doesn't matter whether you're in the University of Nairobi or internet. I think sometimes it behaves. Today has not been a good day. This is not the first meeting, but I'll see. You can hear me? There's sound.
Yes, there is. I can
Hello?
hear you. Yeah.
Yeah, someone is saying that there's no sound. So I think I will keep going as long as, let's pray, the internet works. But what is different, I was saying that we all come out with the same degrees. We have the same training, irrespective of which university you are. There are some aspects of the curriculum that remain standard throughout. What is different is the unique story, our individualized unique stories, and our unique ability to offer the services that we are trained to offer. So what personal branding is, strategic process of shaping and promoting your professional identity. It's about crafting a unique perception of yourself in the minds of your patients, your colleagues, and the broader medical community. Think of it this way. Someone once said, everyone has their own specific vocation in this life, whether we are all medics and we have different missions in life. So you cannot be replaced, Dr. Bonke. I cannot be replaced. Neither can our lives be repeated. And that still goes hand in hand with how we're able to craft our professional identity. So our personal brand is basically us being ourselves and how we're able to project that into our professional work. And so then your personal brand is the experience that someone goes through or gets and is left with after interacting with you as a healthcare professional. Are we together, Dr. Bonke? I'll keep on doing that because of my internet. Can you hear me?
We are. Yeah, I can.
Okay. And your personal brand is essentially who you are and how you present yourself as your unique and authentic self to your clientele. It's the part where you embrace yourself. And why do you need to learn how to create your personal brand? In this day and age, if you're not working on your personal brand, then you're really, it's part of the professionalism that is expected in us. How you tailor your uniqueness into what we are taught in school. So as an undergrad or as you're doing your master's, when you're going through your training, we're all taught how to stand on the bedside, how to clerk a patient, but that rapport that you develop with the patient, yeah, we're supposed to be cordial. There's a lot of integrity. Call a chaperone into the room. but there's a way you would make someone feel or connect with a patient that is different from how Dr. Liz does it and how Dr. Victor will do it or how Dr. Arunga will do it. So there's a caption that I got, it's on a slide. I hope we're there together. Why does personal branding matter in healthcare? According to data that was released in 2020 with the health labor workforce, in that context, Kenya has had a total of close to 200,000 health workers in 2020, and 2/3 of those were in the public sector, and 1/3 of those were in the private sector. And those, close to half, so 100,000 were nurses, 13% were, 50% were nurses, slightly above 50%, 13% were clinical officers, and 7%, which is roughly 14,000 in the year 2020, were medics. When I went and tried to get it from a different site, it was projected that by the year 2022, we had registered within the board, and Dr. Bonke, you can correct me, roughly 10,000 doctors were registered within the Kenya Medical Dentists and Practitioners Board. But irrespective, these numbers keep on growing. We have there's a certain pool of interns that are still waiting to come in. So we're living in a competitive world. We are living in a world that is really digitally and fast-paced. Information is readily accessible. We know there's a new doctor in town, or he's been around for a while now. There are two new doctors. There's Dr. Google and there's ChatGPT or Gemini, and people just, all these AI tools that people use. But guess what? People still want the one-on-one connection with a doctor that they can associate with. You might Can you hear me, Dennis Kipleting, Daktari?
Yes, we can hear you. You had a little break there, but it's back.
Okay, I think the net goes on and off. Where did I leave off? Oh yeah, we're in the same slide. So
Yeah.
in a nutshell, we're saying that there's a rising number of healthcare professionals. A huge number of them are still waiting to be, onboarded or go through internship. And even amongst us, a lot of us are specializing and super specializing, and yet we still come to the same pool. 2/3 of the people who go into training actually want to go to the private setups or want to go to the urban setups. So within and around Nairobi and the confines of Nairobi, there is more healthcare practitioners that work there than the rural setup. So how do you define your own niche while still remaining uniquely as you? How do you create a brand that speaks for you before you even see that patient, or that allows the patient to actually recommend others to you? Yeah. So patients are not only seeking medical expertise because they have these on their phones, but they're looking for doctors who understand them, doctors who can empathize with them, and doctors who connect with them on a personal level. In other setups, there are patients who, you go to a doctor's office and the waiting area is full of patients. And there are others who there are no patients at all. What makes the world of many patients as opposed to a different doctor? So you need to realize and embrace yourself even as you're trying to develop your personal brand. Strong personal brand. Why is personal branding still important? I think one, your reputation. Yeah, it helps you. Yeah, personal branding is not only about the patients; it's about the people that you develop, so that people are able to remember Dr. Bonke. Yeah, reliable, trustworthy deliverer. You should have Dr. Bonke in your team. If you're looking for a board of directors or you're looking for a board of governors or an advisory board, I will be able to mention Dr. Victor. I think that's what I saw on one of the list, right? I'm trying to use different people, but I will be able to refer so and so because I have worked with him on a personal level and I endorse him fully. So a personal brand not only enhances your reputation, but it's able to attract ideal patient clients here. Who are you able to connect with and align with? Are they in keeping with your values and your expertise? Because as you grow within the medical journey, you'll realize that you don't take everything as a cup of tea. There's a time where you say, personally, I love long cases. I love surgical oncology. I can do it anytime. But there are other cases I'll say, I've had enough of those. I choose to now work with patients who oncologically need help. Yeah. It doesn't mean that you don't see the other patients, but you can choose who to work with. Personal branding expands your networks. Yeah, you're able to forge meaningful relationships with collaborating. You're able to know who you can pull into your board of governors as a person, as a brand, who you're able to work with into your next level in terms of career and growth. And then it helps you to stand out in a crowded marketplace and position you as a thought leader. Whether there's crisis management, it helps you think outside the box and you're able to answer as you. I'll give an example of personal branding will make you think of who is Dr. Bonke? Who am I? And what thing? If someone comes and asks to jump the line or to pay you extra, if that's not part of your values, you do not run with that. And they'll respect you because your brand stands for. So learn to invest in your personal brand. And by doing that, you're not just promoting yourself, but you're empowering yourself to make a greater impact on healthcare industry and leave a legacy that you will be known for. Maybe some of you are younger in the room, but I can ask the Professor Hassan Saidi. He had a brand. Yeah. If someone can remember, what legacy did Prof leave? Prof Saidi. What do you remember him for? Because a lot of us are who we are because of what Professor Saidi really tried to do and what continues to outlive him even after he has rested. So there are four main components of a good personal brand. One, authenticity. Yeah. What does your personal brand mean to you? Yeah. And who you are. How do you stand out as your unique self? And what do you stand for? That's why we core values. Yeah, your goal. I'm so sorry, Dr. Bonke. My network is very slow. I apologize for that. Are we together?
Yes, we are. You can continue.
Okay. Yeah, so there's an element of storytelling that we all need to learn. It's something we're not taught in the medical profession, learning how to tell your story, and it's by your actions. I was able to if I talk about health, if I talk about maintaining good exercise, I see you actually exercising schedule. Do you set time to actually do exercise? Even not take alcohol at the again. I am out there with my I am taking, having of your digital footprint. Yeah. And consistent in how you show up professionally. So in establishing Can you hear me?
Yes, I can, though you are breaking. Please continue.
Okay. Let me try, and as I'm trying to move, look for an alternative, a second or third different internet. Okay, so establishing your brand identity, there are key things you need to establish. One, defining your niche in healthcare. Yes, we are all doctors in this room. And how many are we? How many are
We are just
Can you hear
above,
me?
yes, I can hear you. We are just above
Yep.
215.
250. Can you imagine? And we are all in the same, right? Some are specialized. Am I audible?
Yes, you're audible, but you keep
Okay.
breaking. Yeah.
Okay, so
Go ahead, please.
of mama mbogas, yeah, we're in a market. I'm using the example of a market because I don't really want to overly rush it, but there are markets you go and there are 3 or 5 different mama mbogas and they will all have their clientele. I'm sorry to use that concept. And there's a reason why I will go to this particular mama mboga and not go to a different mama mboga. Part of surgery? Is it laparoscopic surgery? Is it women in healthcare? Is it urology? I have a passion for children, or we all have a story to tell. We all have service provision or a service level that in healthcare. Identify what first, it starts with you. So you have to know what your core values are. Part of knowing your strengths is also getting to know what your weaknesses are. And then establishing a personal brand and a mission statement, an individualized mission statement, because you have to start with, what am I known for, or what do I want to impact, or where do I want to influence? So if I'm wanting to transform life through surgery and education, then I have to really work on what key areas do I want to educate the patients or my colleagues? Or if it's mentorship, then I need to actually go out there and look for mentees and mentor them and reverse mentors as well. So what are my strengths as an individual? And some of these things you have to look for close allies, people that you hold dear to you who can tell you honestly what your strengths are. What I might perceive as my strengths are actually might not actually be the strengths that are there. So it needs you to sit down and actually look at your strengths, your core values, key core values, then what your mission is and what your purpose at the end of everything is, right? What are the key characteristics that represent you as a brand? Is it authenticity? Is it integrity? Is it teamwork? I think it's better now. Is it hard work? Yeah. Are you a team player? Are you a enabler? Yeah. Identify your unique style. What is your unique style? Yeah. Are you a person who will enter the room and take things down fast, absorb, tell a story, and then assess the room? Yeah. Or are you a person who, I gave a story of, I went to one of our consultants' clinic and he taught me many years back, but I was so impressed in how he clerked the patient. And this was me as a consultant looking at another consultant clerk a patient. No note writing. He sat, he was able to have a good conversation with the patient, see him, listen to the family, examine, then come down, put notes. We were quiet, and then now walk with us through what he thought was the diagnosis and what we can do in terms of getting the workup. So identify your niche in healthcare, identify your goals, your core values, your strengths, your mission and purpose, and then create a personal mission statement. And I can assist you in doing that. Yeah. Part of personal branding will require you to work on your online presence and your digital branding. So it's important in this day and age, even as a part of your portfolio, as we're looking for work, to have a professional digital footprint, an online platform profile that speaks for you and what you do. So your CV is great, and there are all these research that we get into and publications, but also part of this LinkedIn, we should all purpose and strive to be on LinkedIn because it's a professional platform, which has actually allowed for people in a professional way to be able to tell their story as well. So you can also create a professional website. And then, I'm sorry for the typo, you can work on all these other platforms. I may be a bit more mature, so the Instagram and the Facebook might still apply, but there's TikTok and many others. So it's important because your online presence speaks of itself, yeah? And your online presence should be consistent with what is aligning or put down on the CV. Your online presence should not clash with what you do professionally. In building trust and building trust between your patients and building the relationship with your patients, you need to ask yourself a few things. Who am I? What do you want to be known for? Yeah. Why do you want to really invest in this personal branding? Yeah. Why do you want to build a personal brand in the first place? What's in it for you? The WIIFM. What's in it for me? In me wanting to create a personal brand. Is it self-fulfillment? Then it will go a different way. Is it self-validation? Then you're telling us a story of what you do and how you've walked through the journey of achieving what you want. And that is not a bad thing. Is it impact? Yeah. And the impact is, are you impacting through education, through teaching, through the service provision, through walking through different places and offering the service that you're doing? If it's OB, if it's gynecology, are you able to tell us how you're impacting lives? Yeah. Are you on a mission to accomplish something? Yeah, to reduce or to increase the survival rates. I'm using that because that's what I naturally do. You're increasing the survival rates by teaching about cancer awareness, right? And is it about, just impact, influence, income? Yeah. But as a medic, we have to remember that even as we're trying to create a personal brand, we almost say there's a Hippocratic oath that you took. that says, first, do no harm. And even as you're creating a personal brand, ensure that whatever information you're sharing is not harming you and your brand or your profession, and also not going against what you're doing in terms of the medicine, the medical aspect, and the education that you're giving. So you should really be thorough read. You should, look at literature, really read and ensure what you're sharing out there is legitimate. It's the right thing. How do you engage with your patients through empathetic communication? How do you show empathy even in what you're sharing out here? How do you connect with the patients digitally and also in person? And then how do you maintain the consistency in how you show up each and every single day? Be the same person, whether it's online and in person physically. Let us just have you as Dr. Liz in person and Dr. Liz on social media or in the brand that you're creating, whether you're in Kisumu or Nairobi, whether it's I say this, whether it's a patient who presents to you in a car or a patient who's presenting with no shoes, just if it's equality, if it's compassionate healthcare, it is to everyone that you are providing the service. And I think I started with this at the beginning, a quote by Viktor Frankl, that everyone has his or her own specific vocation or mission in life. Yes, there's 219 of us in this platform right now. Yeah. We are all medics. We've gone through similar training, but we all have a different story that was created or purposed for you and the patients that you serve. Yeah. In you, Daktari, whether it's Dr. Bonke, Dr. Liz, you cannot be replaced and your life cannot be repeated. So let us see the doctor that you are in the service provision and in the brand that you create. Yeah. Each and everyone's task is as unique as is his or her specific opportunity to implement it to the people that we are serving. Our meaning comes from within us. So 3 things you must do as you're creating your personal brand. 1, you have to master your craft. Yeah. Yes, your craft is medicine, but you can uniquely make your craft uniquely you, exciting, something that we see that you're passionate about. Yeah. I think I had a lecturer and a mentor of mine who kept on saying, and it just got ingrained in a lot of us, I can't believe I get paid to go to surgery, yeah, to go to theater and remove that stool, or the smell of burning meat, bovie, yeah. But it's what brings joy. For me, it's the teamwork that goes into theater, the art of, a patient has given consent, they are, in prayer and trusting that they will have the best outcome, opening up in trauma, the warm blood that you touch. My craft is ensuring that I really walk with the patient and work with the teams to ensure the patients really do well. Yeah. What is your skill set? Yeah. Is it mental health? Is it surgery? Is it medicine? Is it telling a story? Is it painting a picture? Is it education in a digitally enabled way? There are a lot of people who are non-medics who are using the digital space. What can a medic do better? Maybe your best place to do that. And then personalize your brand with your craft and your unique niche. You can personalize that brand and you can tell that story online by writing, by sharing how you show up each and every single day. Then now create a strategy of how you're going to do that. It's a lot of work. It requires teams, people who will come, because there are places where you're better placed. You're the one who tells the story. Don't give a digital team and walk away. They do not know your story. You know your story. You know the difficult scenarios where you have to get a consent or stand with a patient. Some of those things hurt you, but they make you who you are. That vulnerability, that authenticity of you crying with a patient or you getting burnt out, someone can learn. You can make other medics learn to take time off and avoid burnout. Some things that might be a challenge in personal branding is the negative feedback that you will get. Yes, there'll be people who are there who will support you. There are people who think medics should not do personal branding, but in this day and age, you need to stand out. We need to know. We need to learn. And part of you being a doctor is the legacy that you want to outlive you and the purpose. And sometimes our day-to-day job will not be able to tell that story. Then how do you balance the personal identity and the professional identity? Do you have different pages? I think with time, we've learned that you can be vulnerable and show the personal aspect in your brand. That is what people appreciate, that you're not there's no perfectionism. Daktari is still a human being. I think I wrote one day an article on humanizing the surgeon, humanizing the doctor, because we're all human beings at the end of the day. Just by having the doctor title does not make you have a stone heart. Yeah. And then also just knowing when to know where to draw the line. Yeah. Especially if it's working with brand ambassadors or if someone is asking you to partner and collaborate with something that you know is not right. Maintaining the Hippocratic Oath and also what is integral to you. So in conclusion, in the realm of medicine where expertise and trust are paramount, and is competitive at the moment, your personal brand isn't just a marketing gimmick. Yeah. Your personal brand is your professional identity, your unique professional identity that speaks of you even when you're not in the room, that might go ahead of you even when you're not in that room. Your personal brand is a perception and experience people have of you that is cultivated through your actions, through your words, through your online presence, and the experience that people have of you. By investing in personal branding, doctors can elevate their careers, your careers, because you're all doctors here. You can make a significant impact on patient care. And also you can impact your colleagues. You can build a legacy that extends far beyond your clinic, far beyond now. It outlives you, but also it helps you in networking and collaborating with like-minded people. I think I will say asante, Dr. Bonke. I made a last-minute resort and chose something that I don't think worked, but it has worked. Before you see, so this is what I've been able to do. I've not done it alone. I work with a team. But I can mention a couple of other, I know Dr. Claire Kinuthia. Some of you might know her. She's ahead of me in medical school, but I love what she does. She has a podcast that talks about it's called Circling the Rabbit Hole. And basically, she's really passionate about reproductive health. And Dr. Swabra Saleh, who is a baby in my eyes because she was in the same school with me in primary school, is also passionate about obstetric and gynecology and infertility, Dr. Sule. So those are some of the brands I see. There's a pediatrician. I do not know his name, but I've also seen him talk about that. I have a podcast, Check In with Dr. Liz as well. That's part of my brand. And these are just the different platforms that I are. I learned that there was Linktree that just combines all this, but then having a website, putting in your articles, you have to be consistent. You have to show up, though it's like you're busy every single day, but it's the little things that you do every single day that is able to tell your story. So thank you so much, Dr. Bonke. I apologize for the internet hiccups, but I'm glad we have finished well. Asante sana, Daktari.
Thank you, Dr. You have branded yourself well, especially with the slides. I like how they are designed and the content is well articulated. Thank you so much. I had requested our participants to share some of the questions. I have some of them on my phone. Let me check the chat box if we have any questions. So Madeline is asking, once you are in practice, how do you start doing online consultations and charging for it? And how do you create boundaries with friends and family, especially extended relatives? Can you please answer that as we get other questions? Hello, Dr. Liz, can you hear me?
Oh, sorry, I was muted. I will go ahead and answer the question, Dr. Madeline's question. The second part where she asks, how do you create boundaries with friends and family members, especially extended relatives? One, understand, Doc, that once you create your, once you start telling us your story, the personal brand, you're creating it and you're creating a digital footprint, the reality is you will be putting yourself out there in one way or another. So in a way, you are actually exposing yourself to the ability of family members and relatives just seeing what you're doing, and what they have or what they think of that might, while it's, I don't know, that's why I wanted an expounding, while they might dissuade you or might talk negatively about it, it all comes back to what we said. You have to know what your core values are, why you're really working on creating that personal brand and investing in it. What are you looking for? Is it impact? Is it influence? Is it fulfillment? What are your core values? What is your mission? And what's your vision? And align those to yourself. Yes, there'll be naysayers. Yes, there might be negative feedback. Yes, there might be people who talk. But if you stick to the cause and you run with it, it will eventually, you will serve the purpose. Yeah. There are people who reach out to Muslim women and talk to them about just in, the negative things about infertility. Dr. Swabre has even talked about it in Kiswahili. And there are people who might not even really want her to do that, but she still does it because her purpose is really to empower and reduce the stigma that comes with infertility and push people to actually come and seek and seek care within Mombasa, right? The first part, how do you start doing online consultations? I think one, you need to ensure that you have a license that is duly in keeping, not expired. Ensure you have an indemnity. I might not be best placed to completely expound on that, but then also with online, you have to also ensure there's integrity and there's patient, what do we say? You really ensure that materials you have, you're not sharing it out digitally. If you're taking notes, look for health management information systems that you're able to work and keep the records. I haven't started doing online. I'm working towards that. But that's a list that I know. Maybe we can expound on it and have someone who's best placed to come and do it. I know there are other institutions trying to remember it out of my head, that allow for you to do digital online consultation.
All right. Thank you, Doc. I can see questions are pouring in. Stephen is asking, is saying, thank you, Dr. Please comment on how to manage anonymity of patient information being shared online, as well as obtaining informed consent for sharing patient data. Let me just keep asking them, then you'll answer all of them. Ogado is asking, will you please give a guide on how and where to go in terms of intellectual property and copyright registration and protection? Paul is interested in developing a personal brand mission statement. I think he can get your contact from the slides and reach out to you. Vincent is asking, how can we incorporate the aspect of critical thinking? Answer up to Vincent, then we'll continue.
Okay. All right. Thank you for those questions. How do you manage anonymity of patient information being shared online, as well as obtaining informed consent for sharing the patient data? I think, Dr. Bonke, I don't know, is there a standard KMPDB consent form? You need a consent from the patient. One, just because of the Data Protection Act, I know that because I run a school, it's very key to get a consent, one for the data that you use, for the photograph that you use, and it should be in written form, and there should be a file so that in case of anything, you're protected. I think something that medics were never well taught of, it's important to identify in our lives the good advocates that you're able to work with, like someone you know who's able to walk you through some of these things. So a good advocate is also able to give you advice on these in terms of just the legal aspects of the data protection. So I think consent taking, whether you formulate that or whether there's anything within the board that allows you to do that, should be in writing, should be signed by both of you, and there should be maybe an advocate who endorses it. Yeah. Dr. Bonke, I don't know if there's anyone else who can answer that much better because we're really starting off, but it's important here to protect the patients if you're using their data online or you're using their photographs online or in any other place. Would you
Thank you for
please
that.
give a guide
We
on
are not in
how?
those.
Okay. Would you please give a guide on how and where to go in terms of intellectual property and copyright registration and protection? Ogado, Dr. Bonke, I think I'll push this question to you. I think it needs someone who's more, not data, but
Yeah,
I think I do not know.
yeah.
And it's okay to say that
Well,
I really don't know.
yeah. I'm noting those questions down, and maybe when we are having a subsequent section on the same topic and theme, we will have someone to answer. They
Yeah.
are being noted.
I'm
Don't
also
worry.
Yeah, I'm also keen to learn because it's so easy to share these ebooks and the materials that we write so people can use it and use it really against you. So it's good to, save your intellectual property and copywriting. And I'm interested in developing a personal brand mission statement. Excellent. Please reach out. We can just walk through or have a session. How can we incorporate the aspect of critical thinking in personal development and branding? That's an interesting question. I think when I think of personal development and branding, the critical thinking aspect is more of a self introspection on one, like where you see yourself and where you are at that moment, because we are all in different seasons in life. Yeah. I may have taken this time of transition or a space or, just a pause based on a number of things that have happened or based on a number of years of just active reading, doing my master's and then working and realizing I want more. I want more than just being a surgeon because guess what? We're all doing medicine and we'll all do the masters. We all strive to do masters after the undergraduate and maybe super specialized, and you start practicing it. But at the end of the day, trust you me, you will realize that there is a bigger calling than just the practice that you're doing. One, what's the purpose of what you're doing? If it's just money, then it will be unfulfilling for you. Is it impact? Are you wanting to do something? Think of the end point when you're retiring. So you have retired. What are the things that you're doing beyond the surgery that will add more value to you? Or are we wanting to live in a rat race where we're 70 years old, still working or struggling to still earn an income? So part of it is working on learning how to invest well right now so that you can do the things that will give you meaning, and work on your brand now so that beyond what you do every day in theater, there's a story that you're telling that's the purpose of what you intend to outlive at the end of the day. Like you have a calling, and the calling, yes, is surgery or medicine. But even with that medicine, there's a bigger calling. And I think the critical thinking aspect is asking yourself key questions. What role do I fulfill? What's my purpose? What are my core values? What is my mission? What's my vision at the end of the day?
All
Thank
right.
you.
That is well
Thank you,
answered,
Madeline.
Dr. Yeah.
Yeah.
There is a more personal question here for you.
Uh-huh.
I think it is asked by Cindy. Cindy is wanting to know how you ensure that you remain humble to society, also your patients, despite the pride of being a doctor.
Mm.
Yes. And then Said is asking, is it allowed to use patient data to be posted online by removing identifiers? And how about patient testimonials?
Mm.
Yes.
Let me start from at the end, right? Patient testimonials is almost like you asking to examine a patient. You will talk to them. You will get a consent. Please do that. Have it in writing in as much as you can also use the verbal form. And then have them write the testimonial, or if you wish to write it, share it with them. And if they want to remain anonymous, that you have to also discuss. If they want their names still written, you have that in-depth discussion with a consent. So that's what I would say. The testimonials add value to your brand because they're now validating what you're doing, and it helps you to impact or gain presence, but ensure that you're also getting consent from the person that you're getting a testimonial from. Is it allowed to use patient data to be posted online by removing their identifiers? I think tricky. But if it was done in form of a research study or data collection, and there was consent from an institution or a hospital, from a research body, yes. So be careful. How about patient testimonials by video? Again, a consent has to be taken in writing and signed and endorsed. Yeah, it does need a consent. Yes. Always protect yourself. It's important to just protect yourself. Worst case scenario, I'm a surgeon, so you always have to think of worst case scenario and ensure you're protected.
All right.
There was the
Uh-huh.
question of how do you ensure that you remain humble to society and more so your patients despite the pride of being a doctor? I haven't answered Cindy's. Are a human being at the end of the day. It's just that you as a doctor has been empowered through training to take care of them. So humbly know that that patient can be your relative, your parent, your anyone. They're humbly at your feet because they are not well. So it's important to stay humble because it's the knowledge that you get that you put together to give them medication and treatment, and they get better. If they do get better, we are grateful. If they don't get better, you still go back to the drawing board and ask and brainstorm, and sometimes also ask a colleague. But you do have to remember that we can also get sick as well. That can be us who seated on the other side. So I think being a doctor is more humbling than pride driven. When you become a consultant and everything, it just makes you realize that at the end of the day, we're all human, and it's humbling for me to be able to treat a patient. Just that.
All right. Thank you so much, Daktari. Thank you for everyone else who've been here from the beginning. All of you joined on time. I'm happy that we had this discussion. I have noted a lot of questions that require addressing, especially with our interaction in the online space, not really related to what we presented today. And hopefully we will organize for subsequent events that will answer those questions in depth. Thank you once again, Dr. for agreeing to be here. I also saw in the chats that some of you are interested on how you can join Kenya Medical Association and be part of the professional bodies. We have a list of the people who joined here, and I think we will find a way of sending instructions on how to be part of the WhatsApp groups and how to join as a follow-up for what happened here today. So I have shared the slides on the chat box. But if you cannot get them, I think we can also share them via email. So thank you everyone for joining. And I can see the KMA president, Dr. Kigondu, is here. Mr. President, if you can unmute and say something or just say hi to us quickly, that would be great.
Am I audible?
Yes, you
Bonke.
are. Good to see you.
Oh. Thank you very much, Bonke. And I really want to thank Dr. Elizabeth Okemwa for a fantastic talk. Some of these talks that the KMA committees are actually giving us nowadays, we as old school wished we should have had them when we were much younger. Maybe we would have been better at this. But Dr. Elizabeth Okemwa has really produced an excellent session on branding. And if any of the doctors should take up this, then the future is very bright. Thank you very much, Daktari. Thank you, Bonke, for hosting these sessions, which are outside, in quotes. Medicine are becoming more and more useful in a more globalized world. So over and above being an expert in your being a physician, a doctor, these other soft skills then are adding to taking people further than they would have gone, like where we are without things like personal branding and mental health like we had yesterday. So thank you very much. And we keep inviting all of you to attend these sessions and give us feedback and tell us more areas in which we can teach you, areas that you need webinars on, and support the association so that it becomes stronger. Thank you very much, Bonke, again. And with that, I hand it over back to you.
Thank you so much, Mr. President, and for your continued mentorship. You've been very helpful in organizing this event. I'm happy that we have finished almost of time. We were supposed to end at 8. We are just 13 minutes after 8. I'm looking forward to having you once again when we have subsequent meetings of such nature. You do have a wonderful night. You can leave at your own pleasure.
Thank you so much, Dr. Bonke. I'm so sorry for the internet. Yeah, but this was
No
fun.
worries.
If there's anything else you guys want to have discussion, we will just reach out.
Yeah. I'll share
Have a
out
great evening.
the presentation. I know it has your contacts there.
Uh-huh.
So we'll reach out as
Yes,
well.
yes. Okay. Thank you so much, and for being patient with me, for everyone being patient with me.
Yeah. Your network picked up quite early, so I know we've picked a lot of information.
Great. Asante.
Yes,